all the noise.
Yeah, get straight to what matters.
Exactly. And today we're looking at something pretty universal, but also deeply personal: aging. Specifically, when our loved ones hit those later years, say 65 and over.
A stage many of us are navigating, or will be.
Right. So our mission today is really simple. Give you a shortcut. We want to help you understand what quality of life actually means then.
And importantly, how to spot those signs, sometimes really subtle signs, that things might be declining.
Yes, the significant ones. And maybe most importantly, how we can offer comfort, offer support when it's really needed.
So for this deep dive, we've pulled together quite a range of sources. We looked at guidance from leading health groups, hospice organizations like VNS Health, VAS Healthcare, and also some significant academic work. There's a big community study from Mazandaran on quality of life, which gives a fascinating global view. Plus, insights from places like Elderly Wisdom Online, the Hospice Foundation of America, trying to get a really rounded picture, without drowning you in data.
Perfect. A clear picture, not overload. So let's dive in. Quality of life for someone over 65.
Yeah.
My first thought goes to physical health, but I guess it's much more than just that, right?
Oh, absolutely.
Yeah.
It's really multifaceted. We're kind of moving past just thinking about extending life, just longevity.
Right.
The focus now is more on dynamic aging. That means actively adapting, trying to thrive physically, mentally, and socially, not just sort of enduring.
Dynamic aging. I like that framing.
Yeah. And that Mazandaran study you mentioned, it really broke this down, looking at thousands of seniors.
So what did it find? What does that picture look like?
Well, it's mixed, as you might expect. About 30%, roughly a third, reported a high quality of life, which is great.
Okay.
But another third, about 34%, were actually experiencing low quality of life, and the rest somewhere in the middle.
So a pretty even split across high, medium, low.
Pretty much. And physically, yeah, lots of challenges. A big chunk, like 40%, were below average international standards for physical performance.
Wow.
And pain is a huge factor. Around 20% had severe bodily pain, often from musculoskeletal issues. It just highlights how crucial early diagnosis and, the right kind of exercise are.
It really drives home that it's not just about can they do things, but are they comfortable? Is there chronic pain involved?
Exactly. That's a huge part of quality of life. And then there's the mental side.
Right. How did that look?
Again, a mix. Over 40% were above average, mentally doing well, but almost 19% were below average.
Okay.
And nearly 37% showed signs of impaired emotional health. Things like loneliness, depression symptoms, maybe early Alzheimer's signs.
That's a significant number, nearly 4 in 10 struggling emotionally.
It is. And linked to that, about 28%, so almost a third again, rarely felt vital or alive. That's quite a finding.
Yeah, that really hits home. It speaks volumes about the internal experience, doesn't it?
It really does. Yeah. And socially, similar patterns. Over half had high social functioning, which is good news. Yeah. But still, 17% had low social performance. And almost a quarter had issues with social activities, often because of those physical or mental health problems we talked about.
Or lack of support, maybe?
Yes, exactly. Lack of social or family support was a key factor mentioned in the study.
So it all links together: physical, mental, social.
Precisely. This study found a clear, statistically significant link between all three and the overall quality of life. Loneliness, for example, wasn't just sad feelings.
Right.
It directly correlated with worse physical and mental health outcomes.
That makes sense. Anything else surprising? Gender differences, maybe?
Actually, yes. This is interesting. Elderly men generally reported higher overall quality of life, better physical health, and social functioning compared to women.
Oh, really?
But, and this is a twist, elderly women generally reported higher mental health than the men.
Huh. That does challenge some assumptions, doesn't it?
It certainly does. Gives you a lot to think about.
Definitely. Okay, so if that's the landscape of quality of life, these different interconnected factors, how does this understanding help us see those subtle warnings, the signs that maybe someone's entering the final stages?
That's the critical next step, isn't it? Because death and old age, it's rarely a sudden event out of the blue.
Right.
The body often gives these quiet signals, sometimes for months, maybe even a year beforehand. But they're easy to miss.
Why is that? Why are they missed?
Because they often seem minor at first, easily explained away as, they're just getting older. But looking back, families often realize, yes, those changes were happening. The clues were there.
So for someone listening, maybe noticing some changes in a parent or grandparent, What should they be aware of? What are these subtle warnings?
Let's break them down. The first big one is often significant weight loss and changes in appetite.
And you mean unintentional weight loss, right? Not dieting.
Exactly. That's the key word, unintentional. They might start subtly, maybe clothes just seem a bit looser, or they just don't seem as interested in food. It's not simply part of aging. It's a signal.
A signal of what, exactly?
That the body's systems are slowing down. It's not absorbing nutrients as efficiently anymore. Muscle mass might be decreasing. The body might even struggle to digest food properly or use protein effectively.
Leading to muscle wasting.
Potentially, yes. And the appetite shift itself is physiological too.
How so?
Well, their sense of taste might fade, making food less appealing. But more fundamentally, the body might be sensing it's starting to shut down.
So it stops signaling the brain for food as strongly.
That seems to be part of it. It's a natural process. And because of that, forcing big meals or lots of protein shakes isn't usually helpful.
Right. It could cause distress.
It absolutely can. Nausea, bloating, even choking risks. The focus really needs to shift towards comfort.
So what does that look like? Comfort feeding?
Think easy-to-eat things. Pureed foods, maybe thick soups, gelatin, ice cream, whatever they find appealing.
Yeah.
And hydration is still important, but maybe just sips of water or ice chips. VNS Health actually points out that this loss of appetite and thirst towards the end, it's natural. It's not typically a sign they're suffering from hunger or thirst.
That's a really important point for caregivers. Okay, sign number 2. Extreme fatigue and weakness.
Yes, and this isn't just feeling a bit tired. This is a deep, persistent exhaustion. Rest doesn't seem to fix it.
So everyday tasks become hard.
Overwhelming sometimes. Getting out of bed, walking across the room, maybe even just holding a cup or having a conversation.
What's causing that profound fatigue?
It's the body conserving energy. Organ function is slowing. The heart might be pumping less efficiently. Circulation weakens. Muscles aren't getting as much oxygen.
So the body's redirecting resources.
Exactly. Energy goes towards just maintaining essential functions rather than outward activity. That's why you see more sleeping longer naps.
And I can imagine that must be incredibly frustrating for the person experiencing it.
Oh, absolutely. Feeling unable to do things they used to. It can lead to frustration, embarrassment, maybe even withdrawal and isolation. It's definitely not laziness. It's a physical shift.
Okay. The third sign. Increased cognitive confusion or withdrawal. This one can be particularly hard for families.
It really can be heartbreaking. You start noticing changes in their thinking, how they communicate, how they interact.
More than just senior moments?
Yes, definitely more than everyday forgetfulness. It's often linked to reduced oxygen supply to the brain because of that weaker circulation we mentioned.
So what might you see?
More frequent forgetfulness, maybe difficulty tracking conversations, getting disoriented, even in familiar places, repeating stories or questions, losing track of time.
And it might fluctuate?
Yes. Sometimes moments of clarity, then sudden confusion. And alongside that, you might see emotional withdrawal.
How does that manifest?
They might just lose interest in chatting or seeing people. Speak less, spend long stretches in silence. It's like the brain is processing emotions differently, leading to a retreat inward.
Mood changes too.
Can be. Some might become more irritable or anxious. Others might seem unusually calm, almost indifferent. It varies.
Right. Okay, number 4. Frequent infections and slow healing. This sounds like a very clear physical indicator.
It is. It's a direct sign the immune system is weakening. Things that used to be minor, like a cold, just seem to linger much longer.
Yes. And recovery takes more effort.
Much more. And simple cuts or bruises, they heal noticeably slower.
Are there specific infections that become more common?
Yes, things like pneumonia, urinary tract infections, UTIs, skin infections, even infections in the mouth. And sometimes antibiotics might not work as well as they used to.
What about wounds?
Chronic wounds can become an issue. Small scratches or sores that just don't heal properly, that can signal poor circulation, poor blood flow, and it increases the risk of pressure sores, especially if they're less mobile.
Is there anything subtle to watch for with infections?
One key thing, especially in seniors, sometimes the very first sign of an infection isn't a fever. It's a sudden change in mental alertness. Sudden confusion can actually be the first clue.
That's really good to know. Okay, the 5th sign. Major changes in breathing or circulation. These often seem quite alarming.
They can be, yes. Breathing patterns might change. They could become slower or maybe shallower, sometimes irregular, with noticeable pauses between breaths.
Is that labored breathing? Are they struggling?
Not necessarily struggling. There's a specific pattern called Cheyne-Stokes respiration. It's like alternating deep, faster breaths, followed by long pauses. It's a natural slowing down process, usually not distressing for the person.
Okay. What about noisy breathing? The death rattle.
Right, that term is used. It's caused by fluids collecting in the back of the throat because the muscles are relaxed and they can't cough effectively to clear it.
Is it uncomfortable for them?
It sounds distressing to us, but the person experiencing it usually isn't aware or bothered by it. It doesn't cause them discomfort.
That's reassuring. And circulation changes.
Yeah, you might notice their hands, feet, maybe their nose or ears feel cold to the touch.
Why does that happen?
The body's prioritizing blood flow. It's sending it to the vital organs, heart, brain, lungs, so extremities get less. That's why they might look pale or bluish or even mottled.
And the pulse.
Might become slower, weaker, maybe irregular. It's all part of that system-wide slowdown.
Okay, so we've talked about these individual signs. If we sort of zoom out and connect this to the timeline, what happens as these signs get more pronounced in those final weeks or days or even hours?
Right, it's a progression. As those subtle signs intensify, the body is actively preparing for its final moments. There's often a kind of timeline, though it varies for everyone.
What might you see, say, weeks before?
In the weeks before, you might notice a deeper sense of maybe resignation, a low mood, less motivation, often more withdrawal from activities.
And maybe reflecting more.
Yes, a lot of reminiscing about the past is common. Physically, that loss of appetite becomes more obvious, weakness increases, fatigue really deepens.
Okay. And then as time gets shorter,
Yeah.
what about the days before?
In those last few days, they'll likely sleep much more than they're awake, moving less, talking less. They might not respond much to conversation, even if they can hear you.
Hearing stays sharp, though.
Hearing is usually thought to be one of the last senses to go, yes, but vision might fade. Other signs, blood pressure, heart rate, body temperature often drop noticeably.
Breathing becomes more difficult.
It can seem labored, swallowing becomes harder, so they might refuse food or fluids entirely. Bowel movements and urination might stop.
What about mental state?
Some might experience hallucinations or seem delusional. Others get restless. And sometimes there's that surprising burst of energy we talked about earlier.
Right, that can be confusing. Then what about the final hours before?
In the hours just before death, the signs that the body is actively shutting down become really clear. Those breathing patterns we mentioned, Cheyne-Stokes, maybe that noisy gurgling sound.
Which isn't distress for them.
Which isn't distress for them exactly. Their eyes might look glassy. Extremities, hands, feet, knees can feel very cold and look quite discolored. Purplish, gray, pale, blotchy.
Pulse weakens further.
Very weak pulse, yeah. And consciousness fluctuates. Maybe sudden outbursts, maybe just complete unresponsiveness. But remember, they can likely still hear.
Hearing is the last sense.
Also,
That's powerful. And then at the moment of death itself,
breathing stops completely. There's no pulse, no blood pressure you can measure. Eyes might stay partly open, pupils dilated.
and muscles relax.
Yes, total muscle relaxation, which can mean the bowels and bladder might empty. The skin can look pale, maybe waxy as the blood settles.
Any post-death movement.
Sometimes, yes. Small reflexive movements of arms or legs maybe won't look like tears. It's just muscle relaxation, not a sign of life continuing.
Understanding this whole process, it really brings up the most important question, doesn't it? Given all these changes, how can we best support our loved ones, and honestly, ourselves, through this?
Absolutely. That becomes the entire focus. The goal shifts completely away from fixing or curing towards comfort, dignity, peace.
So practically, what does providing physical comfort look like?
Little things can make a big difference. If breathing seems difficult, maybe a humidifier helps, or just gently elevating their head or turning them onto their side.
Okay.
Skin and lips can get very dry, so using alcohol-free lotion, lip balm is good. Keeping their mouth comfortable is key. Ice chips, a wet washcloth on the lips, maybe those little oral swabs.
And no forcing food or drink.
Definitely not.
Yeah.
Offer small sips if they want them, maybe soft foods they find appealing, but let them lead. Your body knows.
What about preventing discomfort, like bed sores?
Very important. Gently changing their position every few hours if possible.
Yeah.
Making sure bedding is clean, dry, comfortable.
And the environment.
Keep it peaceful, low lighting. Minimize loud noises or jarring sounds. Let them sleep whenever they seem to need it.
Temperature control.
If they seem cold, a light blanket is good, but avoid electric blankets. If they seem flushed or hot, a cool washcloth on their forehead or under their arms can help.
That covers a lot of the physical side. What about emotional and spiritual support? That feels just as crucial.
It absolutely is. If they're able and willing to talk, encourage it, but let them lead the conversation. Mostly, just be a good listener. Avoid stressful topics.
And even if they're unresponsive.
Assume they can hear you, always. Speak directly to them calmly. Identify yourself when you come in or leave the room.
Physical touch.
Gentle touch, like holding their hand, can be incredibly reassuring if they seem okay with it. Playing their favorite music softly can also be comforting.
What if they seem confused or talk about seeing people who aren't there?
Stay calm. Don't argue or try to correct them. Don't dismiss what they're saying. Just accept it as part of this transition time. It's okay.
And saying goodbye, giving permission.
That can be incredibly important. Express your love. Tell them it's okay to let go whenever they're ready. Reassure them that those they're leaving behind will be okay. Giving that permission can sometimes bring peace.
And spiritual needs?
Yes, if it aligns with their beliefs, involves spiritual advisors, chaplains, or perhaps an end-of-life doula, they can provide specific support.
This sounds like where hospice care really steps in. Can you explain its role more?
Exactly. Hospice care is specifically designed for this phase of life. The whole focus is on comfort, dignity, quality of life when curative treatments aren't the goal anymore.
It's holistic care.
Very much so. It supports the person and their family, medically, emotionally, spiritually.
Who is eligible for hospice?
Generally, it's for someone with a life-limiting illness where the prognosis, if the disease runs its usual course, is about 6 months or less.
How is that determined?
It usually requires certification from 2 doctors, their regular doctor, and a hospice physician. They often use what's called the surprise question.
Which is,
Would you be surprised if this patient died in the next 6 months? If the honest answer for the clinician is no, then hospice is likely appropriate.
are there more formal tools used?
Yes, clinical tools help assess eligibility too. Things like the Palliative Performance Scale, or PPS. It measures overall function, how much they can do for themselves. A score of 50% or lower often indicates hospice eligibility.
Okay.
And for Alzheimer's or dementia, there's the FAST scale. It tracks the progression of limitations. Stage 7 or higher usually signifies severe decline, making hospice appropriate.
Does entering hospice mean stopping all treatment?
Not necessarily all treatment. It means stopping treatments aimed at curing the underlying disease or extending life significantly. But treatments purely for comfort and symptom management, those absolutely continue or can even be started under hospice care. Pain relief, managing nausea, things like that.
So the focus is purely quality of life at that point.
Precisely. And reputable hospice organizations, like Alive Hospice, for instance, are often accredited by bodies like the Joint Commission. That gold seal of approval shows a real commitment to high standards of care.
Okay, so we've covered a lot. From understanding quality of life in those later years to recognizing those subtle signs, the progression, and how to offer comfort. What's the big takeaway here? It feels like it's not really about, fearing death.
No, not at all. I think the core message is about being prepared. It's about feeling empowered.
Empowered how?
Empowered to provide really thoughtful, compassionate care, to help ensure dignity and peace for your loved ones as they approach the end of life, and also finding peace for yourself as you navigate this.
Right. It's about turning what could feel overwhelming into something meaningful.
Exactly. A time filled with purpose, with connection, even amidst the sadness. Knowledge helps us do that.
It makes you wonder, doesn't it? What if really understanding these natural processes allowed us to embrace this final chapter differently? Not as some ending we have to fight against, but maybe as a profound phase. A time for deeper connection, for ensuring true comfort. How might knowing these signs change the conversations you have or the support you offer starting today?